Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today I'm going to be going over how to flush an IV line. So a lot of times in wound care, especially with chronic wounds, a patient may need IV antibiotics. So that's why I figured I would put a video out there of how to flush the line, okay, if needed. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. Caution, this video is made for educational and entertainment purposes only and is not intended as medical advice. I strive for 100% accuracy, although errors may occur and nursing protocols may change. Always verify the latest protocols and obtain necessary nursing credentials before practicing skills. So you first want to start by gathering supplies and perform hand hygiene. So what you'll need to actually flush the line is you'll need pre-filled saline flushes, either 3 cc's or 5 cc's. It just depends on your workplace protocol. You'll need alcohol swabs and gloves. So what is the purpose of flushing an IV line? So saline fluid is a mixture of salt water that's compatible with your body's fluid and tissues, okay? So the reason that we're flushing it is to push any residual medicine or fluid through the line and into your vein to prevent it from getting gunky inside, really. It also keeps the line clear and it reduces the risk of infection and occlusion, okay? So this little cannula is sitting inside of our veins, so blood is going through. We want to make sure that it's clear and it doesn't get clogged, okay? So when are we flushing an IV? So before and after medication, in between infusions, and this is as per protocol. So I've seen daily or every 12 hours. Normally we're flushing 3 to 5 cc's of normal saline with a start-stop method, okay? So you're pushing a little bit in, about 1 ml, and stopping. Another 1 ml in, stopping, okay? It allows to get all the junk out a little bit better. Okay, so just an important thing here. Different caps, okay, these have different clamping sequences, okay? So to put on this clamp, some you take off the syringe first, some you leave the syringe on. So just make sure that you're looking at your specific manufacturer who's made these and look at the clamping sequence. It doesn't matter at all, but I just wanted to bring that to your attention, okay? Okay, and then we have everything ready. We're going to assess the IV site. Is there any redness, pain, drainage, swelling? Is the dressing intact? So we want to make sure of all these things before we ever flush, okay? Because if somebody has redness in this area, there's obviously something going on with the site. We need a new site, okay? If the patient was having pain last time, during the infusion, you know, is there drainage leaking out, swelling? Is the dressing all coming off? Okay, if the dressing's coming off, then bacteria can get into here. So we have to be very, very cautious and make sure that this dressing and everything's okay with the site before flushing. Okay, so now we're going to prepare the saline flush. So this is a saline flush. I only have 10 cc flushes, okay? If that's all you have, it's perfectly fine. We only put in about 3 to 5 cc's, okay? So we removed this from the packaging, okay? Now there is an air bubble in here. There's always an air bubble. So what we do is we twist this, okay? It doesn't have to come all the way off, just give it some room. And then we pull back. I always pull back because if it's like stuck there. The syringe is like stuck, and if you push it, I've seen this so many times where somebody has just pushed it and you'll get a fluid start squirting and hit the ceiling. So pull back and then you can easily remove that. Okay, and you have a little bit of saline come out there. So that is ready. Now you're going to place it on either a clean surface or back inside the packaging. Okay, and you're just going to wait to use that. So you place it aside. Now you're going to clean the hub. So this is the hub here. This would be attached to the patient and you have your lock here. Okay, so you would have your clean, washed, gloved hands. You're going to use your alcohol. Okay, you only need one. So you take the alcohol swab, you put it over top of the hub, and you go in a vigorous motion, getting this part and also where it screws in. Okay, you want to get all of that. You clean it for about 30 seconds, making sure you're removing any bacteria. Okay, because any bacteria on there, it could get in and then it goes right into their blood, giving them a blood infection. So that is not something we want. We want to make sure that we are cleaning this very, very well for 30 seconds, and then you let this air dry. Okay, so this is now dry, and you don't want it to touch anything, okay? So you have your saline that's ready. Twist the cap off, and see how I'm being super cautious with this? It's not touching anything. This is ready to go, your saline flush onto your hub. So you have to, it gives a little push. There's a little bit of resistance there. Push and twist. Okay, now that's twisted on. We are going to unclamp or nothing will flow through. So you unclamp that and you're going to pull back on the syringe. Okay, you're pulling back on the syringe to obtain a blood return. Now, just a little bit, it doesn't take much, and watch right where this starts, okay? You don't need to pull a whole lot of blood. You're just looking right where you can see it come out of the arm, really. As soon as you see a little flash, that's all you need. You have blood return, and then you push in with a start-stop motion. So you start pushing 1 mil, pushing 1 mil, pushing 1 mil. Okay, you have 3 mils in that start-stop motion. Okay, we're also, while we're pushing it in, we're looking to ensure that there's no swelling or pain at the insertion site. Okay, make sure you ask your patient this. Is there any pain? No? Okay. Now you're going to lock this out in accordance to the manufacturer. Sometimes it does not matter. Always look at that. Me personally, I always lock it and then remove. Some matter, some don't matter. Okay, so just make sure you're looking at the guidelines for your specific hub that you're using. So now you have your IV flushed and locked, and it's ready for its next use. Okay, so that's all I have for this video, guys. I hope you did find it helpful, and I hope to see you in my next video. Bye for now.